So, I mean, excellent presentation, and I think excellent example of using results from research into actual implementation. So, thank you. Next up, we have Mr. Yesunesan from Aravind LAICO. He's part of their consultancy team and works at capacity building of the partner hospital. So, welcome.
Thank you, sir, and good morning to all. So here I would like to share with you the learnings and experience we had in running a which hybrid collaborative learning program, 12 months collaborative program with 7 eye hospitals. So cataract is the leading cause of global blindness, and in India, cataract contributed to 66% of blindness. And in India, 7.2% of those who have undergone cataract surgery are blind, and one of the major reasons is surgical complications. And even for borderline and poor outcomes, the surgical complications and lack of spectacles, mainly for residual refractive error, not providing glasses post-operatively, are the major reasons. And having this as a background, LAICO launched a 12-month program uh, to enhance the cataract surgical outcomes of hospitals. So, 7 hospitals from India, Bangladesh, and Nepal enrolled for this series. And the overall objective of this program is to achieve post-operative visual acuity of 612 or better in the operated eye in the latest follow-up, ranging from 8 to 49 days. So one disclaimer is that when we enrolled these hospitals, many hospitals, there was no baseline. The day one was there, but the final follow-up data was not there. And in some hospitals, it was not a practice at all. So with this baseline, we started this program. So the collaborative study started with collecting the baseline, and then an ophthalmologist from Aravind and a management consultant from LAICO visited the partner hospitals mainly to understand the current practices and also to understand the gaps, where the gaps is in regards with the surgical outcomes. Then the core team members from each hospitals were invited to LAICO for in-person learning session, where we discussed on the factors contributing for good surgical outcomes. For example, starting from documentation, strengthening the protocols, sterilization, having good sterilization in place, accuracy in biometry, having good infrastructure. So all those, and have surgeon skills also. So all those things were dealt in the learning session. And then followed by that, one faculty is assigned with each of the hospital, and they engaged in weekly calls with those hospitals. And every month we had a monthly review meeting, virtual monthly review meeting, where the cohort of hospitals, they joined and they present their challenges and the learnings what they implemented from the change ideas. So results, these hospitals performed 41,584 surgeries. This is for 6 months period, and we were able to get 83% of the data for day one, the immediate post-op, and only 53% of final follow-up data we were able to get. And the average age is 62.5, and male is 55% and female is 45%. And we included both the outreach and direct walk-in patients for this program. So 55% the surgeries came through outreach and 45 through direct walk-in. 68% are SICS surgeries, 32 for FACO. Now coming to the results, one of the major thing we found is, as mentioned earlier, 41,000 surgeries by 7 hospitals in 6 months' time is a very good numbers. But when we started to analyze, it was very difficult for us because there was no data, especially the final follow-up data. Only 53% were there, and many studies have proven that there needs to be a final follow-up few weeks after the cataract surgery because of the change in the astigmatism and reducing in the corneal edema. And but here, because of non-availability of data, the first thing every hospital did was to find a way to document the final follow-up data. So here I would like to present a case study on a hospital which got enrolled in this series, which is in Nepal here. So they were doing surgical camps, and they were doing surgical camps in the vision centers and also in some schools and colleges. Uh, the one thing is like they were not able to get the final follow-up data. Even day one was missing for many of the patients. So what they did after enrolling in the series is, first thing they did is, as a management and the clinical team, they discussed among themselves and made up a decision that the first thing they need to do is to document the final follow-up data. And then what they did is they oriented all the people at the vision centers and also at the base hospital to how to document the final follow-up data. And they also circulated templates to the vision centers. So whenever the patient comes, they have to enter. And in addition to that, they also call the patients prior to their follow-up date, the final follow-up date. And this was also monitored, like how many surgeries were done through that vision centers and how many turned up for the follow-up. So this is one thing, major thing. Other change areas implemented by the other hospitals in the cohort were developing relevant IVC materials and giving post-operative counseling, mentioning the importance of follow-up in the post-operative counseling, sending SMS for follow-up, and training the ward staff also to inform the patients about the importance of follow-up, organizing follow-up camps at the camp locations. So the other insights what we got from this program is that there was a very good improvement from UCVA to BCVA in the follow-up. So we learned that not only bringing the patients for follow-up, so many hospitals, they devise strategies to ensure that they do refraction at the final follow-up, and then patients are sent to the optical shop. They ensure that patients are buying glasses, not only prescribing that, but patients are buying glasses. And they also check the compliance rate for the glasses. And some hospitals, they also strengthen their biometry procedures, accuracy in A-scan. They trained their ophthalmic assistants who did A-scan. And also some hospitals, they change the incision site from superior to temporal to reduce the astigmatism. And another important learning we got is like patients with the preoperative vision of normal, mild, and moderate had more chances of getting good vision, good visual outcomes. So this insight gave us like early intervention is necessary for cataract for getting good surgical outcomes. So all the hospitals together, what they did is they revised their advice protocol. So they standardized the advice protocol and ensured that patients who can benefit from cataract surgery should be diagnosed and advised for surgery. So that one change thing. And in addition to all these change ideas, uh, some of the other change ideas like formation of quality audit team. Yes. Yeah. Okay. Daily review of case sheets, entry of 100% of data, and then shift to topical and subtenant blocks. Also did. So the lessons we learned and the challenges, the first thing, the consistency in data entry, because if you see our objective, the overall objective is to enhance the cataract surgical outcome. But before getting into that, we need to have strong data to understand, to analyze it. So the first thing we learned is the completeness data and consistency in the data. So the second thing is team involvement. Even though we involved the core team, the ophthalmologist, the optometrist, and the manager who forms the whole team, we found that there needs to be a bigger team involvement to bring this change, especially who are directly involved in cataract outcomes. And we also found wherever the leadership engagement is there in the hospitals, we found some very good results from the beginning of the leadership. And also not the least, uh, the change in the mindset because many hospitals, when they enrolled in the series, they started, it is difficult for them to get all this data because of manpower, because of infrastructure, everything. But when we realized the importance of data, they started to, that they found ways to get it done. So to conclude, I would say the findings highlight gaps in surgical outcomes and follow-up practices, and there needs to be a robust data collection for better follow-up systems and evidence-based intervention to enhance cataract surgical outcomes. Thank you.